Imagine your little one is feeling under the weather, perhaps with a fever or upset stomach, and they just refuse to drink anything you offer. It is a common and concerning scenario for parents. This reluctance to take fluids immediately raises the question of whether dehydration is setting in. Understanding the nuances here can bring a lot of peace of mind. Yes, if your child refuses to drink fluids, they are at a higher risk of becoming dehydrated, and this is a significant warning sign that requires close attention. While not drinking is a major indicator, dehydration is a spectrum, and the severity depends on how much fluid has been lost, how long the refusal has lasted, and other contributing factors like vomiting or diarrhea. The core mechanism of dehydration is an imbalance between fluid intake and fluid output. When your child is sick, their body often uses or loses more fluid than usual due to fever, vomiting, diarrhea, or even increased breathing rate. At the same time, illness can reduce their appetite and thirst sensation, making them less likely to drink. If they then actively refuse fluids, this gap widens quickly, depleting essential electrolytes and water needed for vital bodily functions, impacting everything from energy levels to kidney function. Instead of focusing solely on the refusal to drink, which is crucial, also observe other key signs that can help you assess your child's hydration status. Pay close attention to how many wet diapers your baby has or how often your older child is urinating, noting if it is significantly less than usual. Look at their eyes to see if they appear sunken, check the inside of their mouth to see if it is dry and sticky, and gently feel their fontanelle, the soft spot on a baby's head, to see if it appears sunken. Also, notice their overall activity level. Are they unusually lethargic or irritable? It is important to understand that early signs of dehydration can be subtle, sometimes appearing as just tiredness or crankiness. Pediatricians often refer to a mild case as simply being dry, while more severe cases requiring medical intervention. One helpful tip is to try offering small, frequent sips of fluid, like a rehydration solution or even clear broth, rather than large amounts at once, which can sometimes overwhelm a sick child. The key is consistent, gentle encouragement. Ultimately, observing your child for a combination of these signs, rather than just one, will give you the clearest picture of their hydration level. Promptly addressing reduced fluid intake and recognizing early symptoms allows you to intervene before a mild concern escalates into a more serious medical issue. Your quick observations and proactive steps can make all the difference in keeping your child comfortable and on the path to recovery.